Welcome to the show. Hi, I'm Randy Jeffers, and we are live from the entertainment capital of the world, Las Vegas, Nevada. Well, we have a show for you that you don't want to miss. You want to make sure you go get a piece of paper and a pen or a pencil because you're going to be writing down some information because this is absolutely fabulous. We have some special guests here. And first, I want to introduce from Clear Fusion. We have Dr. Allen, the CEO of the company here, and we have Dr. Michael, who is the medical person for Clear Fusion. And we have a special guest, Greg Crosby, who has a program that I can't wait to hear about. It is just absolutely fabulous. So Greg, if you would, just give us a little bit of a rundown about the history of the program and maybe hit some of the highlights, if you would.
Sure. We got this concept, my partner and I got this concept about 6 years ago when we saw how the Affordable Care Act was going to roll out, and we knew that the things they wanted to accomplish, there's no way they were going to be able to accomplish it and still be able to reduce premiums, make it more affordable. We knew exactly what was going to happen. What was going to happen is premiums are going to rise. They had to, because now they wanted to cover 20 million more people. Well, in order to do that, your cost has to go up somewhere.
Right.
So what we've seen, and especially this last December, when people start getting their notices for premiums for next year, people's premiums are almost doubling in some cases. So we knew that two things were going to happen. Premiums were going to increase, and deductibles were going to have to go up. The out-of-pocket expenses that every mom and pop was going to have to spend on their families. So we knew that was going to be a big problem. And then the other issue that we knew was going to happen is now employers, in order to provide health care for their full-time employees, they were going to start cutting hours, which meant now full-time employees were now going to be cut back to part-time employees just so they don't have to provide health care for those employees. And this was going to be a tremendous problem.
Well, it is a crisis situation. Every day on the news. I just heard something this morning. Now, one of the big major household name insurance companies is pulling out of the exchanges, and it's just a crisis. What's happened to our healthcare system in the last few years, and it's just probably going to get worse. And so, this is a perfect time now for a program like yours. But Dr. Allen, Clear Fusion is a company that is so unique. You've been on our show before, and Clear Fusion is. Partners up with great companies and great programs like Greg has, and makes those available to not only the people but also to other companies that have large distribution. So it is a perfect program for you guys to partner up together with. And tell us a little bit about what you see in this program.
Well, it's perfect for Clear Fusion, and those people that may have seen us talking about the company before will remember that we look for people to partner with that may have a hole in their portfolio. They may just need some help and assistance with distribution, or they may need a website, or they may need some marketing, financial input, that sort of things. Or it can be everything. It could be, remember we talked about somebody has a dream.
Yes.
But it's going to remain a dream unless they find a team.
What was our saying? A dream is only a dream until you have
a team.
The team. Yeah.
And so that's what Clear Fusion is doing. So I've known Greg we were just talking earlier, for 10 years now, and we've done some work together on and off, and so this last few weeks, Greg and I have been talking about various things, and he introduced this health benefits discount card to me. I said, this is perfect, absolutely perfect for Clear Fusion. So everything that Greg said is absolutely correct. It's, we are in a state of flux. There's nothing that's consistent. Every day, as you said, Randy, there is a new issue, there's new uncertainty. And one of the things I love about this program is consistency.
Yeah.
It's there, it's at your fingertips. If you've got your phone, you have a doctor right next to you, because one of the major benefits of the program is if you're sick in the middle of the night, what are your options? Get out of bed, drive or be driven to an ER, wait for 2 or 3 hours to be seen. You're in excruciating pain. It's going to cost you a lot of money. If you're out of state or out of your network with your health insurance program, you maybe charge an arm and a leg for that because it's out of network.
Yes.
And so, what if you're on vacation? What if you're at home and your child is got an earache in the middle of the night? What do? You do all of those crazy things, cost a lot of money, stay in agony for hours.
Yeah.
With Greg's program, you pick the phone up. And you dial the number. You go into the phone app and you have a doctor calling you back within a few minutes.
Wow.
Which is not bad, Randy, if that's 2 o'clock in the morning. And you can see the doctor on a video conference, or you can just speak to the doctor, tell the doctor what's going on, and the doctor will then find out where you are, send a prescription to your nearest pharmacy, and then you just go down to the pharmacy and then present your pharmacy discount card and get a great discount off the medication, and then you're back home. So your loved one never left the house.
This is really the future. Yeah, I mean, the future
This
is
is the
now,
future
isn't it?
of medicine.
Because
It absolutely
I was at
is.
a fast food restaurant just a couple of days ago, and you order on your phone
Right.
and on an iPad, and then you don't talk to anybody anymore. And I know, Dr. Mike, you have the background in the medical world, and you've seen this tremendous upheaval and how things are changing at such a rapid pace. And I mean, to be able to make a phone call when there's an emergency is incredible.
It's really unheard of, Randy. When you stop and think about just what Alan said, the fact that the cost of healthcare and medicine and doctors and hospitals continues to go up. That's because the cost of everything begins to rise. But the cost for this card is a one-time, once-a-month cost, and you have unlimited access to medical professionals that can diagnose most things over the phone. Now they can also tell you if it's an emergency, you need to go to the doctor right now. For example, say somebody is having signs of a heart attack. They're not going to prescribe them a medication over the phone. They're going to get them to a hospital right away. Men, in particular, who have heart attacks, are very, very stubborn. They want to wait and wait and wait until they die. And the truth is that 54% of the time, the first sign of a heart attack is, in fact, death. Only 46% of the people survive their first heart attack. So the doctor that you talk to is going to say, get to the hospital right now, or call an ambulance right now. Then let's say, as Alan said, it's an earache. What about urinary tract infections, or a cold, or a flu, or just a really bad migraine headache? We have to wait until the doctor opens the next day, or the urgent care, and then again you have a small fortune. This way we can get it done right now, right before your very eyes, and it gets done. The savings over the years are tremendous, especially if you have a family. Let's say you have a family of 4 or 5 kids. My goodness, you're running to the doctor all the time.
Yeah.
But it's almost always for the same thing: a cold, or a flu, or a runny nose, or sinusitis, or whatever. Adults, one of the main things that people go to the doctor for is a backache. Most backaches can be cared for with a small prescription, but the people just needed an advice. So that's part of the benefit. But the other part of the benefit, of course, is the discount health card, and the discount, along with this same card, the discount in pharmaceuticals. The cost of drugs today is outrageous, and we can get anywhere from how much? What was the percentage off on pharmaceuticals?
Well, depending on the medication, we can get up to 90% off
Wow.
on prescription costs.
Which is tremendous savings. Tremendous.
It's tremendous. Well, let's do a
is.
commercial right now. I ask everybody to get your pen and pencil and a piece of paper, but you have some special discounts available right now as we speak, I understand, and they go to your website, and that website is?
They go to our website. The website is www.123healthy.me.
Healthy.me. So that's the number 1, number 2, number 3. So 1, 2, 3, healthy.me. Okay.
Not .com.
No.
No.
.me.
.me. Healthy.
Okay, and in order to get the special Clear Fusion discounts, are there any codes or anything that we need to know about?
Yes, we've been talking this last few days, and Randy's been very gracious to assist people that are watching this show. And so when they sign up, when they check out, they put in an offer code. It's called Offer 100, 100, Offer 100. Then they're going to get a very special price, because the price is $32.95 a month. $32.95, but there is a $40 activation fee. So what Greg has done is very graciously waived that fee. So there'll be no $40 sign-up fee.
Oh, fabulous.
Right.
So it's free. It's literally free to sign up.
Yeah, and then
Correct.
$32.95. I've always wanted to do this, but wait, but wait. No, so the services that are offered, not just the 24/7 call a doctor and the discount prescription cards, but also there is a discount vision and a discount dental program as well. So 4 programs that go with it. Now, a lot of people have pets, and people spend so much on the pets. Statistically, I've seen that they'll spend more money on their pet's health than their kids' health.
People will, easily.
So Randy has Greg has also put in another element to it, that there is a pet prescription or
wow.
discount card as well. And also we had one other, chiropractic. Now, I maintain that health really starts with what you eat and how you behave and think and that sort of thing, but being preventative and going to a chiropractor is very, very important.
Yes.
It's gone a long way since the old days of just crack your bones. Chiropractors have a broad spectrum of solutions for your health now, and Dr. Michael here can speak better to that, because he's spent many, many years as a professional career chiropractor with setting up many, many clinics in Chicago. So chiropractic care is very important. It can
Very
solve a lot
holistic
of problems.
care. Yeah.
It is,
All
yeah,
holistic.
it is, it is. So you get those six elements.
Well, let's take these one at a time. Now,
Yeah.
the first thing you
Right.
said was 24/7 being able to call a doctor or a healthcare a person. Now, that just doesn't seem possible. How many are there restrictions? Tell us everything about that. How does that work?
Well, the way it works is very simple. You go to when you join, you get a membership ID. You go into our system and you register your family. Everybody's covered in the family.
So no matter how
children
many
up
kids
to
I have?
26.
Right.
Correct.
Okay.
No matter how many children you have, everybody's in the family is covered, as long as they're living in your residence and they're under the age of 26.
Right.
And then it's very simple. Whenever you need to talk to a doctor, whether you have a child that's not feeling well, you wake up in the middle of the night and you have an earache, or
Stomach
you
ache?
mentioned the stomach ache, or you mentioned the UTI. These are all things that be very painful, especially if you prolong treatment.
Yeah.
We have a smartphone app, so you can just pick up your cell phone, go to the smartphone app, or you can jump on a tablet or a laptop.
And it's extremely
Go to our
simple,
website.
very user-friendly.
Log in, you tell us what the symptoms are, and you can either select a doctor that you want to talk to, or just click on next available doctor, and then one of our doctors will give you a call and talk to the person who's having the ailment, the problem, and try and diagnose what the issues is. If there's something that can be solved simply with an antibiotic, then they will automatically electronically send a prescription to whatever pharmacy you choose.
goodness.
It's a very simple program, easy to use, and I think the biggest thing about it is just the peace of mind, the comfort, and that you get from knowing, no matter where you're at, if you're on vacation, let's say you take your family to Disneyland or Disney World or Universal City or whatever, and a kid wakes up in the middle of the night not feeling well, that can ruin a vacation.
Absolutely.
But it might
Yeah.
very easily be taken care of just getting on the phone, talking with one of our doctors. You might even just have a question about, I want to take a new nutritional supplement. are there any possible side effects because of other medications I might be taking?
Yes.
That's a big one, isn't
That's
it?
a huge
Yeah.
one.
It's very big. And what we suggest to our members is there is no per call charge.
No, that's a big thing. That's a big
It's
thing.
very big. So call
So
our
I can call
doctors
as much
first.
as I want.
You
I mean,
call as many
anytime-
times as you want.
My goodness, for
For just one-
$39.95.
32.95.
Yeah, yeah.
Is
per
the
month.
price that your
And that
members
covers
get.
my family.
It
That's
covers
my
your
whole-
family.
Wow.
And let me just point out that there are other telephone doctor systems out there, right?
Oh, there's yes.
But
There's-
they almost always have a copay along with it. Is that correct?
correct.
And that can be anywhere from $25 to $50. Yes.
Well, I've never seen one as low as 25. Most of them are between 45 to 49.95
So you might just as well go to the doctor, because
at that price.
at that price.
Unless it's the middle of the night.
But then you can't go to the doctor.
Correct.
And if you go to the ER, you can expect to accumulate hundreds of dollars in charges. Some may or may not be paid by your insurance.
Correct.
Well, especially if you're out of your
Jurisdiction,
network
your
as
network.
well. I mean, Greg's an avid golfer and he loves the water as well. So this is a true story. Just recently, Greg was enjoying himself at the side of a swimming pool, got some water in his ear. We know how painful that can be, and it can turn pretty nasty pretty quickly. So that was just in the afternoon. So he had every opportunity to get dried off, get dressed, go to the ER or whatever, you know. But he was out of his home area, so his insurance was now out of network for his insurance. So what did Greg do? Well, Greg's smart. Greg has the program. He
Thank
picks
you.
his phone
He
up.
even looks smart.
He
does
looks
look
smart, doesn't he?
That's
I need every one of you
Distinguished
guys to call my
looking.
wife and
and just tell her how smart
let her
you
know how
are.
smart I
That's
am.
it.
He's
We'll
about
do it.
6'6". Of course, I'm going to say he's smart. You
Yeah,
know?
that's right.
So he got out of the phone, dried off, goes into his app, pulls up, gets a doctor, and the doctor said, "Yep, we know what it is. Yeah, blah blah blah." Get down to the doctor. Where are you? Notice where he was. Sent a prescription into the local pharmacy, wherever it was. Greg just dried off, got in the car, got the medication, and he's back around the pool within an hour.
It was that
goodness.
easy.
So that's a practical, realistic example of a success with it. There's another one that Greg told me as well, if you don't mind me telling the story.
Not at all.
Some friends of Greg and Debbie, their son got married recently, and off they went on honeymoon. Greg's out to dinner with the parents, and they told a story of their son and his wife came back from honeymoon. She was in agony. Late at night, called her mother-in-law, said, "I'm really in so much pain, you know, stomach, and what am I going to do?" Said, "It sounds like you have a urinary tract infection. It's going to be very painful. Get to the hospital, get to the ER." Said, "I don't want to do that because probably half an hour away from a hospital. I know I'm going to be sitting there for 2 or 3 hours before I'm seen. I'm in more agony, and then got to get back home, and it's going to cost me at least a couple of $100.
Right.
If only they had Greg's card, this is how it would have played out. Husband would have gone down, or wife would have got on the phone, told the doctor what was going on. Doctor would have put a prescription in. Husband, getting points here, would have gone down to the pharmacy, hurried back. It's done.
I've got another example just happened this morning. I was playing golf at one of your beautiful courses here, the TPC Las Vegas. I got back and I got a phone call from a CEO of a company in San Diego who had found out about our program, and my friend had given him my number. He called me directly, and he was suffering with a sinus infection. He says, "I know that I was about to go down to an instant care facility to see a doctor, try to get a prescription, but they said to call you first." So he called me, we got him hooked up into the system, and literally 5 minutes later, he's talking to one of our doctors, and he got the antibiotic he needed for a sinus infection. He says he gets these from time to time, and if he doesn't, most doctors, in fact, the last time he went to an urgent care facility, they said, "Well, there's certain protocols that you need to do for sinus infections, so you need to use some sprays and flushes for the next week, and if you still have it, come back and see us." Well, he says, "I've done this. I've had this enough times. The sprays and the flushes don't work for me. What I wind up doing is I suffer for 7 days, and then it's into bronchitis.
Oh my goodness.
Yeah, that happens.
So
Frequently.
yes, it took a doctor 8 minutes to call him, gave him an antibiotic, problem solved.
8 minutes it took.
It took 8 minutes for a doctor to call
You
him.
can't even go to a doctor's office
No.
and expect to see him in 8 minutes. It just doesn't happen.
You can't even get into your car and drive to a doctor's
Yeah,
office in
cannot.
8 minutes.
You cannot.
Right. So fabulous program.
So for $32.95 per month, I can get that incredible benefit of being able to call a medical professional, and in just a matter of just a couple of minutes, be talking to that and get my medical condition solved. Just it's that
It's
easy.
that easy.
So that is incredible by itself. But as you said, what
There's
did I hear
more.
you say? Wait. Did
But
I-
wait! I want to be on I want to be like Billy Mays. I want to be on an infomercial. But
That's
wait.
right.
No, so we have.
Call now and we will give you.
Yeah,
That's
we'll
exactly
double
right.
up.
Double up.
So you then have the prescription card, discount card, of course. But then there's a vision card, vision
No,
discount.
let's talk about the prescription card. What does that do?
Well, it can give you up to 90% discount on your meds, whether it's in an emergency situation or just regular routine medications that you're purchasing.
Can you walk us through it? Because I'm always cautious, as I'm sure a lot of other people are,
Oh, yeah.
when somebody says up to something, you know, so up to 90. How does it work in real life? What is there an average savings or?
A lot just depends on the medication.
Okay.
You know, some medications are generic, then of course you can get a little better discount. Those that aren't generic, the pharmaceutical companies just don't give much of a discount on it. So it's hard to say like an average, but I can give you an example. What Alan was telling about when I had my my ear infection. Went to the pharmacy, and I do have medical insurance. I gave them my because I was out of network. I was in Palm Springs. I wasn't home. So I gave him my insurance prescription card, and I said, price it with this, and they priced it. I said, okay, now price it with this card, and I gave him my 123 Healthy Me discount prescription card. My prescription card saved me more money than what my health insurance
My
prescription
goodness.
card
Oh,
did. So what we suggest to our members is, if you have, if you're one of the lucky ones who has a good health insurance plan, always double check, reprice, use our card to make sure you are getting the best price on that medication that you need.
you know, it's no wonder that that the whole medical industry is in such an upheaval.
It
I
is.
mean,
Right.
it's so
all
messed
over
up,
the
isn't
board.
it?
It's all over
Yeah.
the board. Pricing, there is no such thing as consistent pricing anymore. I remember years ago, the government pretty much forced all of us into having standardized pricing. You had to have one specific price, and you couldn't vary that price. It was actually illegal within the Medicare system to change your prices.
Wow.
And now, you know, depending upon what health card you have, or whether you walk in and pay cash, or whether you have Blue Cross Blue Shield or whatever, you're going to get a different price. There's a different price for each and every program out there. The nice thing about this program is that it's very consistent. Very consistent.
All right, so we have two things now. So for $32.95, I can call my doctor anytime, 24 hours a day, anytime there's an emergency or anytime I have a question, right? And that,
Correct.
in and of itself, is worth $32.95 a month.
It's worth
Peace
a
of
whole
mind,
lot more than
Randy,
that.
yeah.
It's really worth hundreds of dollars per month.
I can see that, and then on top of that, now I also have prescriptions, right? So I can get discounts on prescriptions, and you gave some great examples, but
There's more.
Discount vision.
Wait.
But wait.
There's
Oh,
even more.
Oh wow!
come on, Billy Mays, I gotta have you.
So there you've got discount vision
Uh-huh.
and discount dental.
Okay, well, let's take vision then. So how does the vision program work?
Well, a similar sort of way, and it depends what you're going to have done. You know, eye tests, eyeglasses. You can present
Contact
that card,
lenses.
Contact includes contact lenses.
You can get a discount. Now, you know, you can go on the internet and start looking around and spending weeks and weeks or hours and hours shopping around to save a few pennies. But it just comes back to this one-stop shop, this all-in-one place system that, look, you know, I'm going to get a great price, and you just pull your list up and see which vision shops are giving.
So you have a list of practitioners, vision practitioners that have already that are part of the program.
Correct.
Uh-huh.
And if
Great
they go to
news.
our website, it will show them that. But
Right.
it really, it's really quite simple. What we've done, what we've spent the last 5 years doing, is going to these large networks, doctor networks, vision networks, hearing networks, all these big networks of healthcare providers, and we have pre-negotiated discounts for our members.
The lowest discounts.
In most cases, we've got the same pricing from these providers that they would receive from an insurance company. So because of our membership, they're willing to pass those savings, because there is a lot of savings to the doctor. Now he doesn't have to worry about billing an insurance company. Now we don't have to worry about waiting for 90 days while they hold his money for float. Now they don't have to worry about a insurance payer saying, you know what, we're going to deny this,
We don't wanna
and you
cover
got to
that.
fight us to get your money.
That's right.
They don't want that. So the pricing we've been able to negotiate with these networks is a tremendous deal,
Yeah,
tremendous
absolutely.
discount.
And cash is always king, as we know. And doctors, believe it or not, have become so put upon by the insurance companies, as you say, waiting 60, 90, 120 days for their money to come in, and then fighting with them over what's customary and what's paid. And that. If a patient walks in and is willing to pay cash, most doctors are willing to give a 30, 40, 50, even 60% discount. So just like you said, they don't
Right.
have to hassle. And it's a benefit to the patient, and believe it or not, it's a big benefit to the doctor. They love it.
Oh, that's fabulous. All right, so I can call my doctor.
Uh-huh.
I can get my prescription drugs at a discount, and I can get vision. But
Wait.
wait, all right.
I'm logging
You got to
this.
have another one now, huh?
Dental, discount dental,
Dental,
as
okay.
well, and that includes cleaning. It can include extractions, fillings, that sort of thing. So, from a health perspective, that's 4. There's another health perspective, one, which is chiropractic care, discounts on chiropractic work.
And the rates there, I can speak for this, the rates for the chiropractic care are both beneficial to the patient and to the doctor. Better, in some cases, in some states, the discount is greater than what an insurance company would normally pay the chiropractor. So they'll
So it's
get
a win-win,
It's
yeah.
a win-win for everybody there, and everybody. I'll put in my plug for all my fellow chiropractors. Everybody needs to get a checkup and a tune-up at least a couple of times a year, because our backs wear out. They're just like every other thing. They're very mechanical, okay? And unlike some of the soft tissues in the body, the back wears out, probably is the most wearing part of the body. And it needs to be tweaked, and that's what chiropractors do. And then they do nutrition and electrostem and all kinds of physical therapy, so see your chiropractor.
Absolutely.
I can verify that. I had a parachute accident back when I was 26 years old. So it's been 4 or 5 years ago. And
Oh yeah, 4 or 5 years, yeah, that's about right.
I actually shattered my C2 vertebrae
Jesus.
and then separated my neck. So because of the stress on the spinal cord, I had paralysis until after surgery.
Oh my gosh.
So, but since then, chiropractic and massage therapy has been, a
lifesaver
very
for you.
routine
and necessary.
necessary thing for me
To keep it from getting worse
to
and
feel
getting,
to feel
spreading
halfway
throughout
normal.
your spine. That's
Yes.
right, exactly.
It's amazing the therapeutic relief
Absolutely.
you can get from chiropractic, and especially, if you can combine that with massage therapy, it's
Absolutely.
unbelievable.
Well, I've lost track of how many.
Oh, we have
how
one
many
more.
di-
Well,
different-
no, this
okay,
is the best
so-
one.
But wait,
One
then.
of the best ones.
But
I
wait,
have another one.
All right.
Pet care.
Yes.
I saw a study once, just a few years ago, that I think I mentioned earlier, that people spend more money on their pets' health than they do on their kids' health. So to get a discount on pet care, pet health, veterinary services, is huge, because
Yeah.
it can be incredibly expensive. So to be able to get a discount, and again, you're going to ask, how much of a discount? It depends on what you have, what the your pet requires. But hey, if you can save $10 or $20 or $50 or $100, is it better in your pocket or the hospital's pocket, the vet's pocket? And they want to do it because it's a way of attracting business to them and getting more traffic, if you like, more patients. And so that's a great thing, so that's well worth having as an additional item.
yes, what we've done is we have negotiated a deal with PetAssure, which is the largest organization of veterinary hospitals. and our members get a 25% discount on any service that they receive, whether it's shots. Well, Michael knows he's a pet owner, right?
I have two Scottish.
We're done with pets.
Yeah, no, we have dogs, and we have always had dogs, and they are an expense. We love them, and we can't live without them. But they get sick too, and they don't get real
Right.
sick, but they can't really talk to you. So the veterinary services and the discount, because we have two dogs, so we have to take them in, and everything is twice as much all the time.
So you have Scottish dogs. Is there a reason that you have Scottish?
It's because my wife is from Scotland, so we have Scottish dogs for the Scottish woman.
But our members get 25% discount on all veterinary.
And that is
services.
huge, guys. That's huge.
That's
I
huge.
can't even get that kind of discount, even if you have pet insurance, which we have had in the past, and it's very expensive. It's
And what
very
did you pay
expensive.
for your pet insurance?
I think we paid $75 a month.
Wow.
Cutting that in half, and you get an even weight. You get more benefits.
Well, we have some more as
With
well.
this
We've been
program.
talking to Greg, and I don't know what's going on with Greg today, but he's just giving us.
He's just
giving us
giving it away
services.
today.
I do play Santa during
Yeah.
Christmas
Well, you're
time
paying
for some
Santa
family
in
members.
February.
Yeah.
So what I'd like to do is before you mention anything else,
Mm-hmm.
is I'd like to go over the dental a little bit.
Okay,
with
sure.
Oh yeah, that's
And
good.
Greg,
For their members.
before you do that, let's give the website out one
Oh,
more
yeah.
time for
Couple
those that
times.
Sure.
didn't quite get it last time. Okay, so the website
The
is
website is 123healthy.me,
okay, healthy.me, and so you put a www in front of that.
or not, depends
Or
on
not,
your
it goes
browser.
Either way, okay.
Yes, works either way. 123 numbers healthy.me.
And to waive the activation, there's a code, and the code is
Offer 100, 100. Offer 100.
We have to spell out offer, correct?
Spell out
Correct.
offer.
OFFER 100.
Okay.
That will completely waive our activation fee.
Okay, perfect. Okay, you were going to say?
Well, I was going to say about the dental, because dental is very important, especially when you have children, and everybody should have a checkup, or at least a cleaning every year. On our dental, we have pre-negotiated rates with Dentamax, which is the large association of dentists.
Yeah.
There's over 200,000 dentists nationwide that are part of our network.
So there has
So-
to be one in your community.
Oh,
Has to be.
Most people will have a choice of dozens and dozens of
Yeah,
dentists
especially here
that they
in
want to
Vegas.
see.
Yeah.
The dentists they currently see could very easily be part of the Dentamax
Probably
network.
is, yeah.
They probably are. And with the dental, they typically see savings of 40%. Wow. Sometimes more. For example, crowns.
huge. That's huge.
Crowns nowadays typically are about $1,100 to $1,200.
Yes.
With our membership card, you go into a Dentamax dentist, crowns are only $600.
So that's almost a 50% savings.
Right.
Or it is in some cases
Right.
at 50.
Right. I mean, you take a look at any of these services that we're offering, be it the pet care, dental, any one of those, more, the savings that you get for there more than offset the little $32.95 a month.
Oh yeah. Now is this also true with orthodontics for children?
Yes.
So
If your children needs
Oh my
braces,
God, that is
typically we can
huge.
save you. Typically, we'll save 1,000 or more per child or per person who needs.
and adults,
Braces.
more and more adults are getting braces for their teeth.
Yes.
Yes.
I got
And-
braces when I was 40.
Yeah, and
Really?
and, because not only is it cosmetically necessary, but as we age, it also becomes very necessary because of the structure of the mouth and the way the teeth close and the way we bite
Right.
and the way we eat. And it can cause headaches and all kinds of problems. So, and snoring, it can cause all kinds of snoring problems. If you can believe that, misalignment within the mouth can cause snoring problems and problems with the hard and soft palate. So, a lot of times it's necessary, medically necessary, to have those changes made. Now, here's a way to save, as you say, hundreds to thousands of dollars, depending upon the devices and the.
Typically, it's about $1,000 savings on braces.
Wonderful.
My situation was my bite was off. So
Yes.
because of that, at night I would grind my teeth.
Grind.
Yeah.
So I had an option: either get dentures
Right?
or have it corrected through
And
braces.
it's much better to have it corrected if you can.
Sure.
Sure.
Anytime you can keep your natural teeth,
Absolutely.
it's always better. So
Identical.
it's once again, it's just another benefit we provide that it's hard to put a dollar figure on your savings. It all depends on the size of the family. But what we do know, according to medical journals, is the average family of 4 go to a doctor's office on average 14 times a year.
Wow.
And also with telemed, what they've seen is telemed, they say that 80% of all office visits could be handled with a phone call.
That's true.
So if you're saving 80% of your office visits every year, and you're a family of 4 on average with 14 visits, you're saving yourself about 11 visits to the doctor's office every year. I mean,
Wow.
that is just pure convenience and pure savings to your bottom line.
At a cost of $50 to $100 per visit on average.
Every time I walk into my doctor's office, I have to write them a check for $75 just to have the right to see the doctor.
That's correct.
And I have insurance.
And specialty doctors are even more.
Sure.
See, I like simple. I like consistency. I like to know it's there. And people carry their cell phones around with them, just like it's like they're glued to their hands. You
Right.
always have your doctor
In your
in
hand.
your hand. Yeah, doctor in your hand.
That's
But
a great name for it, actually.
Doctor in your hand.
Yeah, there you go. But
Get that URL.
I'm getting even more excited here, right there. I'm getting even more excited.
$32.95 a month. That is
It's
just-
unbelievable.
And each one of those actually would be a good deal at
By
$32.95
themselves.
by themselves.
Right.
Yeah.
As an insurance policy.
And so I don't know how many we're up to now. 6, 7, 8.
Well, we've got 6 there, I think. I had to write these down because my memory's not so good, so I had to write them down just after my side here. But we have 3 others.
Well,
The
so
Greg's
what's the
very
magic
graciously-
word?
But wait.
All right, let's
We
do
have
it.
3 more.
So we also have a weight management discount program as well. Now, of course, nobody needs weight management help.
Now, why are you looking at me? Huh?
Well,
You have a coat
This
that's
is-
covering it. I don't.
now Greg's had a lot of experience using this one.
I'm a very slim 275.
There you go. Yeah, and, I'm just under
yeah, but
tall.
you're 12 feet tall. So
Yeah, there you go.
I'm just under tall for my
Not
weight.
overweight, I'm
Yeah,
under tall.
yeah.
But people try diets. The next best thing. Times of year. It comes up to summer. They want the beach body, or just after Christmas or New Year, they start making their resolutions. They don't stick to them because a lot of
Right.
diet programs don't work.
Right.
It's always good to be aligned with somebody that you're accountable to.
right.
And you'll increase your success rate of sustained weight loss if you're accountable to somebody. So, this program, this extra program that Greg's including, allows people to get extra assistance on weight management. In
So
fact,
this is a buddy concept, is that right? You have someone that you can actually work with?
Correct. They can call one of the counselors, weight management
Weight
counselors, and help them design a program for them to achieve
Wow.
whatever goals they have set for
And
themselves.
it's more of a lifestyle counseling, may I interrupt, and say as much as it is a weight, because it's a way of managing your lifestyle so that you don't feel like you're on a diet. We don't like
that's a
diets are
4-letter
horrible.
word.
We
Diet-
don't like it. We don't
Diets
like
are
it.
horrible. It has to be a lifestyle change, gradual and incremental changes on lots of different things. It takes a little bit of time. But again, having somebody that you can talk to that's accountable to you, that you're accountable to, that's designing a program for your lifestyle.
Yeah.
So that's huge as well.
Well, that by itself is worth $32.95. I mean, how much do people pay for programs?
I don't
out
know.
there?
Call
They pay-
Marie Osmond.
They pay they pay fortunes for
Yeah.
programs.
Yeah.
Hundreds
Absolutely.
and thousands of dollars
But
sometimes.
Wait.
Well, wait, there's
There's
more.
more?
But wait.
all right.
Do you know that children as young as 4 are now suffering hearing damage because of those little earbuds that they're putting in their ears?
Wow.
And so, we're raising a society of people in a culture that's suffering from hearing damage.
Yeah.
Hearing
Yeah.
loss.
And so another program that Greg offered to put in, which we very, very excitedly accepted, was a hearing aid program as well. And that means, going and having your ears tested at an audiology lab. And
Right. It gives our members the access to be able to go in, have a free hearing test. if it's found where they need hearing aids, they get discounts on the hearing aids,
free
on
hearing
batteries,
test.
or
Free.
whatever they need.
And you know, a hearing test can cost, again, anywhere from $75 to $200, depending upon where you're going and who's doing it. And the other thing is, you want to have an independent hearing test as opposed to one necessarily that is done by somebody who has to gain from selling you a pair of hearing aids.
What?
I just beat me to it.
Actually, I can say just last week I went and had a complete hearing exam at a center, just probably 3-4 miles from my home,
Wonderful.
and zero. I didn't have to pull out my wallet. I just showed my membership card. It was completely free, and it was they put me in a sound booth room with a headset on, and they would test out different tones and
Right.
levels, and it was. I was extremely impressed with not just the amount of time that the doctor spent with me,
There you go.
but the quality of the exam that I had, and then the time after the exam to sit down and show me exactly
Show you the
where
chart.
my weak spots were, where my strengths were, and
Right.
and knock on wood, my hearing was even better than the doctor's, who was 20 years younger than me.
Wow.
So
That's wonderful.
all that rock and roll, in the 70s
Yeah.
Well, it
wasn't
must-
as bad as I thought it was.
It damaged my ears, I can tell you that.
Yeah. Well, I know we're running out of time, but I want to just make one comment on hearing because I have a long history in noise-induced hearing loss and technology, and you have to have your ears tested because there are all sorts of things, elements bombarding it, and it doesn't repair. It
Right.
just does not repair. So having it tested will enable you to see if you have something that's deteriorating and will enable you to stop doing what's causing that deterioration,
Right.
even in young children. So get your children tested before it's too late, because you've got to be able to have a conversation with somebody. You've got to be able to hear them, and if you can't hear somebody, deafness is horrible. In fact, when I was growing up, there was an old gentleman that was blind, and somebody asked him, do you feel that life's dealt you a cruel blow, being blind, you can't see anything? He said, well, I still have my hearing, so I can always have a conversation with a friend. And he was that was very powerful.
Very powerful.
We have one more thing, and how long do we have left? Just about 3
not much.
minutes. Lab testing. Lab testing.
What kind of lab testing?
Lab testing, it's blood testing. And
Now, we're not testing Labradors.
we're not testing Labradors.
Oh,
Mike.
okay, so, all right.
But if you have a Labrador, we can test it. Greg will throw a Labrador testing.
I have a
program
joke about
for you.
that, but we probably won't have time.
Yeah. But lab testing is becoming more and more popular. You see TV ads of companies that are doing lab testing to test your DNA to see, what your heritage is. Whether you're Native American, African American, Caucasian, Swedish, whatever it is. And so this is a lot of fun. But real lab testing is going to tell you what is going on with your body, for broad spectrum lab test, because it may show you that you have early signs of diabetes or some other disease, liver disease, and
Your hormone levels.
Yeah, knowing what's happening to you, knowing what could happen to you, gives you a great chance to prevent it, because genetics are only a very small part of you.
Yeah.
Your genetic inheritance. It's really environmental, your own personal lifestyle. So when people say, "Oh, I'm genetically, wired to be overweight," not really.
not really.
I'm genetically wired to have cardiovascular disease. No, I don't think so. Just a small percentage.
I'm wired to like ice cream.
Well, I know that. Yeah.
Yeah, and that's
Yeah.
okay. That's an all right.
Yeah,
That one's
okay.
all right.
Yeah, but we have an ice cream addiction card for him as well. But
For $32.95 by
$32.95.
itself.
It's all part of 30.
But wouldn't you like to know what's going on? Some people will
Yeah.
say, "No, I don't. I don't want to know." Well, fine, have at it. Have a nice death.
But if you want to know, we have a great service.
Yeah.
My wife just recently, last week in fact, went and had her hormones checked. The older women get, of course, my wife, if she's watching,
did you just
she is
say she was old?
significantly younger than me.
She is young.
But she had her hormones checked, and she found that she was low on estrogen, and she was low on this, low on that. So now she can get back in the balance, and that solves a lot of issues with women, whether they get migraines or what have you.
Aging. Anti-aging is all about managing. A big chunk of it is managing your hormone levels.
And I saved about 50% on the lab
This
costs.
has to be one of the biggest parts of all this. I was thinking that maybe being able to call the doctor, which is huge, but I think this testing is so big.
It all works together, Randy. It
Yeah.
all works together. So
It's just phenomenal.
peace of mind.
Well,
Precisely.
yeah, I guess that's the important part of it, isn't it? It's really having peace of mind, and you know that for $32.95 a month, you can just feel good that no matter what's going to happen, what comes your way, and life
it's not
life
gonna
brings
bankrupt
us.
you.
Yeah, you're not gonna. You're going to be able to solve most of those things.
Well, I'm grateful to Greg for working with us at Clear Fusion
Absolutely.
and giving us these great programs. So
Well, guys, thanks for being with us, and I can't wait to hear more. So we'll have you back on and give you more specifics.
We'd love to.
Okay. We'll see you next week, same time. Bye-bye, everybody.